I'm Dr. Fiona Lovely, and this is the Not Your Mother's Menopause podcast. I'm taking the taboos of menopause and peri-menopause and bringing light to the dark. No bullshit, no shame. It's time for us to gain a new paradigm in female health, out with the old and in with the new, and I'm bringing fresh perspectives from someone in the arena. I've been practicing women's health for nearly 20 years, and I'm spilling the tea on what it means to live at midlife, knowing that the best is yet to come. I'm sharing my Gen X approach to living through this transition. Sassy, a bit sweary, and always honest. Tactical tips and instantly usable information is my aim. I hope to make you laugh and that you learn something new that helps you embrace the change. Together, we bring power to the peri. Onward to the podcast. You're listening to the Not Your Mother's Menopause podcast. I'm Dr. Fiona Lovely. Thank you for joining me today. Today, we're going to have the discussion about stem cells and where they fit in the whole landscape of the anti-aging spectrum, if you will. Today, I welcome Dr. Joy Kong, stem cell expert, triple board certified anti-aging physician and specialist, renowned for her expertise in stem cell therapy and commitment to educating both physicians and the public. With a strong presence in the industry, she has established herself as a trusted voice through her extensive lecturing at national and international conferences, as well as her publications in scientific journals. As a dedicated educator and pioneer in the field of regenerative medicine, Dr. Kong has founded the American Academy of Integrative Cell Therapy and trained numerous physicians from around the world. Her innovative approach has also led to the creation of Chara Health USA and Chara Biologics, premier companies providing cutting-edge products and services to patients across the United States. With numerous accolades, including Stem Cell Doctor of the Year and Stem Cell Doctor of the Decade, Dr. Kong continues to be a respected figure in the medical community, dedicated to advancing the field of regenerative medicine and improving patient outcomes through her emphasis on scientific data, passion, authenticity, and integrity. Her inspiring memoir, Tiger of Beijing, which she recounts her remarkable and memorable journey as an immigrant from China at the age of 20, starting with her visa rejection in 1991, and was named 2020 Book of the Year by IAOTP. Now, Dr. Joy Kong and I talked about a variety of subjects related to how we regenerate cells, what stem cells are, where they come from. By the way, be prepared to have your mind changed on that, because it turns out stem cells can come from a lot of places. Be open to hearing what she has to say about how her own health changed with regular infusions of stem cells, but also stories of her patients, which I found to be some of the most inspiring parts of this conversation. She and I talk about how the science has come so far in the advancements of the aging process. It used to be the kind of thing I referred to it with her as the Jetsons science. The truth is, this is our reality now. How cool is that? So what do you use stem cell therapy for? I certainly am familiar with it in the realm of sports medicine, but to hear her talk about it for other things, I think was part of the most important part of this conversation. There's just lots to be learned. So she tells us how they're delivered, how they're collected, how they work, where they come from. One of my favorite moments was when Dr. Kong tells the story of when she was working as a psychiatrist, and one of her mentors working with her at the time used stem cell therapy for an autistic boy. And what happens to that child when having the infusion of stem cells? Remarkable. Listen in for that story for sure, because I'm telling you, this was one of those conversations, guys, where it's going to challenge a lot of the thinking you have about things, and it's going to make you realize that if we're really on a beautiful learning edge of how to age well, and it's just not all that weird. I ask about stem cell applications for peri-menopause and menopause, and I ask the mechanisms of how stem cells reverse aging. Again, such a complex subject, but somehow Dr. Kong made it really interesting. And I want you to pay attention to how she talks about stem cells as a potential therapy for cancer. So interesting. We talk about growth factors. We talk about mesenchymal stem cells, in case you want to know what it's called when the stem cell potentiation is measured. It's the mesenchymal stem cells, or the MSCs, are the ones you want. So, can you grow them in the lab? Do they have to come from human source, etc.? This is the conversation we had. Really a very fascinating discussion. I hope you find it so as well. Without further ado, here's my conversation with Dr. Joy Kong. Are you navigating the changes of menopause? You're not alone in experiencing shifts like weight gain, sleeplessness, and body changes. As sex hormones such as estrogen change, they can affect appetite and how your body uses energy. It is not surprising then that in addition to other changes, many women notice increased appetite and reduced energy expenditure. Studies have shown women typically gained around 3.3 pounds a year during the perimenopause transition, potentially reaching an average gain of 22 pounds by the time we reach menopause. This is distressing. This includes increases in fat mass, especially around the abdomen, reduction in muscle mass called sarcopenia, exactly the things which contribute to frailty as we age. To help manage this, it has been estimated that women need to reduce their caloric intake by around 200 calories a day during the transition. But stress, feeling hungry, or battling cravings can make that challenging. I would like to introduce CaloCurb, a plant-based, all-natural supplement. CaloCurb is a patented, world-first GLP-1 activating supplement. It contains amerisate, a natural extract from a specific variety of New Zealand bitter hops. Taken an hour before meals, amerisate is released into the small intestine from a patented capsule. It works by stimulating bitter taste receptors in your gut to activate your body's own gut hormones like GLP-1, CCK, and PYY3, the hormones that help you feel fuller, longer, and slow down gastric emptying. Clinically proven, CaloCurb has been shown in studies with women undergoing fasting to reduce overall hunger by 30% and overall food cravings by 40%. It has been shown to help reduce calorie intake by 18% on average in studies. CaloCurb is designed with no artificial ingredients, sugars, calories, stimulants, or caffeine. Alongside physical activity, strength training, and protein-forward nutrition, CaloCurb can help you work towards your goals. Empower yourself during menopause, ladies. Let CaloCurb help you stay lean and energized through midlife. Visit calocurb.com and use the code LOVELY10 for 10% off your first order. This is the Not Your Mother's Menopause podcast. I'm Dr. Fiona Lovely. And Dr. Kong, I'm so excited to have you on the show, which I was just saying to you. And thank you for the sweet compliment. I appreciate that very much. I think it's a voice that was born for radio, I guess, is what I've heard. So
nice.
Thank you. Thank you. Now, you are coming on the show as our first regenerative medicine and anti-aging specialist and expert, MD, triple board certified. I'm so excited to talk to you about your topic today, which is regenerative medicine and stem cells in particular.
Yes.
So exciting. Which is so cool. So, I look at the way medicine has really evolved in the last, I don't know, even 10 years, let's say. And it seems to me that anti-aging medicine, the science is real and ready for us. It's not something out there that maybe one day we'll see happen, it's ready, it's happening.
Yes,
And is that true?
it's actually true. It's a little scary, but it's true.
Oh, no, it's good. Here's the thing I say on the show to my listeners all the time is we don't want to see aging in ourselves the way we watched it in our elders. And I think we're at a beautiful time, a beautiful conjunction of Generation X and the elder millennials are saying, we're not going down like that. Science is ready to help us with it. So tell us a little bit about how you got to be the person talking about regenerative and anti aging medicine, please.
The answer is I don't even know.
Okay.
Yes, I don't know how I got here. I just loved the moment I heard about what stem cells could do and actually seeing the evidence of it from a real case. That's when I thought, okay, all right. So I was taught all this stuff in medicine. And then in this particular case was autism. I thought I knew how to handle autism. Of course, it was abysmal because what psychiatry was doing. So I was a psychiatrist in my past life.
Mhm.
And what we could do was very limited. And then this one doctor I met who treated this kid with autism using umbilical cord-derived stem cells. With one infusion, he was making changes. Of course, the family never told the teacher. They had no idea what's going on. The teacher started to notice all these differences. Like there are like 40 things listed: better eye contact, better expression, better, no longer procrastinating, and more, as far bowel control, etc. Like all these things, and I just couldn't believe this guy did. This doctor did a simple IV infusion, and he had no knowledge. Really didn't know autism the way I knew. Right, I was trained on all these conditions. Autism was kind of the realm of psychiatry, so that's what really prompted me to dig, because if some miraculous thing is happening with what you put some cells in the body and this happened, why, how, what's going on? So the curiosity, and that's what I want to bring this to really people's attention. The curiosity, what about the miracle of life? Have you, it's just that stem cells maybe has become such a buzzword, but what about what it can do? Doesn't that inspire you? Think about it.
Yeah. Yeah.
You've done all this training, you have all these medications, and you can't make a dent on this patient's condition. Let's say Parkinson's or whatever, some autoimmune conditions. And there it goes, somebody that was not even trained in your specialty, give this infusion of these cells, and your patient just got way better, like something you could never do. You can't even imagine, because you tell the patient, well, this is all I have. This is really, this is as much as I can do for you. Yes, there's slow progression and decline. And then all of a sudden, somebody put something in your veins and the person's getting better. You better be curious. Otherwise, you're betraying your job as a healer of why you went into medicine. And that's the part that's a little hard to see. It's sad because so many doctors have strayed away from their true passion, this love of knowledge, this curiosity of wanting and really doing everything they can to help. So if you're rejecting stem cells, when stem cells have made such a difference for so many people, then you really have to question, why are you in medicine?
Mm.
So
Hmm.
anyhow, but the moment I found out about this, that's when I just started reading and reading, and there was no textbooks because this was 9 years ago. So the only way you can learn is by reading published articles, because the articles will have an introduction. The
Hmm.
introduction section will give you the background of everything, right? So that's like a little piece of textbook, very, very small textbook, and you learn from that, and then you read another article. So I was piecing everything together to really have a full understanding of what stem cells are, how are they making these changes, and what are the right ways to approach the therapy and what types of cells there are and what kind of evidence have we seen. So that's I think and I couldn't stop talking about it. I just the moment someone get me like you touch stem cell, oh, there it goes. So I
Yes.
just it just it's
I
so
love that.
inspiring. It's so cool, right? This is like tapping into the secret of life.
Okay, we got to unpack that. So I love this conversation about curiosity because it's true. We lose that sense as we get older for whatever reason. I think we may very well feel boundaried by our professions or our legacy or our community or whatever. But you're so right when you say if you stay curious about things. And I always say when I get the youngsters that come into the office and say, Dr. Lovely, I don't know what I want to do with my life. I say, don't worry about that. I know you get pressure from all kinds of places. Just follow your curiosity. Let it turn your head just a little bit and then go that way and see what comes up. You never know. You
Mm.
absolutely never know. I love what you said about this autism, the child experiencing autism getting the stem cell injection or the IV infusion. Wow. I that would have blown my socks off too. I totally get why you went, I got to go over there. See what
Yeah, it's
that's
like what's
about.
going on with these cells? How?
So what did you figure out when you started to look? What happened? What changed in that particular case?
Well, I wanted to understand what kind of cells these are and just what can they do for the body. So what I found out is that yes, we're all born with lots of stem cells because we came from a single stem cell. So we have really we were first like this cluster of cells, right? And they were all very primordial stem cells. And then when we form a full human, right? When the baby is ready and is born, this little human is still having all these stem cells in the body ready to repair and regenerate, right? This little human probably is going to damage himself, herself, run into something, eat something terrible. Yeah, there's going to be all these damages. These cells are ready to repair this little human being. However, as you grow older, as you do more damage to yourself, eat bad food, drink alcohol, cigarette smoke, environmental toxins, and UV damages, etc., you start to lose these cells. You not only lose them in number because they die off, you also lose potency. They start to not be as effective and as ready to work. So even just when we reach our teenage years, we've gone down to 1/10 of the amount of stem cells we had when we were born. So
Wow.
yeah, if you do an operation on newborn, you may still see a scar, but definitely the earlier you are, the smaller the scar is going to be, right? Because your body just ready to fix right up and make new tissue. But the older you are, the slower the repair is. And that's why age is the biggest predictive factor of chronic illnesses because you just can't fix it anymore. So now we can bring some cells back in here, got the right signals to tell your body how to fix it. So that's why, and this is one of the powers from stem cells, because they have the untainted messages. If you use your own stem cells, it will still be helpful, but your own stem cells also have been damaged as you age. When you make a new human, woman and man, having a baby, there's a biological reset. A lot of the damages and everything is this spark of light. There's a reset, right? There's a miracle. So what we're using in our practice, and also I've taught hundreds of doctors, is using this very young source of stem cells. If you can find untainted cell sources in our human body, that's great. Unfortunately, we haven't done the reset. We just look at the sperm and egg, right? Very, very essential, these primordial cells. When these two come together, they make a new human. But even the sperm and egg start to age and they start to be defective. So we're not that protected. The environmental damage will get you no matter what kind of cells you are. So you're going to start to lose potency. And when you put back in the body these very young, these reset sources, then you have clear messages and correct messages. and then your body can just repair itself in a way that a much older or sicker body cannot anymore.
Okay, well, how do we get them? Where do the stem cells come from?
It comes from, well, anywhere in our body, we have stem cells. So you can harvest from your own body. But the one I use, the reason I choose this one is not just because, that somehow because that's the first thing I encountered, is because I went through careful analysis of different sources. So if you compare umbilical cord derived stem cells versus the two other most popular sources, it's bone marrow derived stem cells and adipose derived stem cells. And both
Okay.
will carry, the cells will be of your own age. So when there's direct comparison between these different sources, the umbilical cord stem cells are always coming on top. They have longer lifespan, they have longer telomeres, they have more generations left. They can, divide a lot more number of times. They have wider differentiation potentials. The growth factors they secrete are more potent and wider range. So there's more types of growth factors. Yeah, they're just the neuroprotective effects, etc. So everything that you're looking at, the younger cells is superior. So that will be the type that I use. And that comes from the umbilical cord. Umbilical cord is just just like what a gift, because it comes from this primordial, right? The younger source. So when the embryos is forming, there's the placenta, there's the cord. The cord, of course, is connecting to the little fetus. And when the cord was forming, there's all these cells that get trapped in the cord and they stay there. We don't know exactly what their functions are yet, because you certainly don't need the cells if you just want to protect the blood vessels, right? Then why not just make a tube that's just full of collagen and full of some matrix? Why have cells there? But no, it's rich in stem cells, in this type of stem cells called mesenchymal stem cells. So why are they there? If indeed umbilical cord's mission in life is to cushion and protect, right? That's what the FDA keeps talking about, cushion protect.
Mhm.
So you must give back the cells for the same purpose. They must cushion and protect. And
Yeah.
I was like, how do you know what the cells are there for? You think we need those cells to cushion and protect? You really
Yeah.
think so? Okay.
Yes.
All right. A little naive, right? So
Yeah.
that's a whole other subject. So
Yes.
someone somewhere thinks they know it all, right? They think
Yes.
they know what everything is there for.
Yeah.
So just please have some humility. Just
Mhm.
realize that there's so much we don't know, but we can harness some of these powers that's given to us. That's part of
Yes.
us. So these
Yes.
cells were trapped very early on
Mhm.
in the embryonic formation period. So they carry a lot of the primitive characteristics that only exist in the much earlier stem cells, that's lost in the stem cells that's in the baby. So the baby stem
Mm.
cells are not as potent as the umbilical cord stem cells. So you can't just,
That's interesting.
yes. So they're younger than the baby. And then what we do is a mother, by the way, we screen mothers very heavily. We screen them for everything, anything that can have anything to do with the health of the baby and the umbilical cord is screened for. So their own health history, family history, their prenatal history, their travel history, work history, toxic exposure, everything. All that's screened for, sexual history. And we also do not accept women. So the laboratory I work with, we do not accept women that have been vaccinated by the COVID vaccine. So I don't care what your
Interesting.
position is. If you come to me, there's too much unknown. I am not going to jeopardize my patients because we still have a lot of unanswered questions. So
Yeah, we
that
do.
is a pet peeve of mine. I'm never going to compromise on that point. So when the mother that fits all the criteria under the age of 30, when they're
Mhm.
about to give birth, they're asked, first of all, we only accept elective C-section births because we want to be able to obtain the tissue in a sterile field. We don't want to introduce everything that's in the vaginal canal. And if you have child or have seen a childbirth, it's not a sterile.
It's not sterile. No, it is very organic.
Just
Very.
put it that way. So, um, so we only choose women who wanted to just do elective C-section. So then it's a surgical field. Everything will be obtained, sterilely. So then that once the baby's born, the cord is cut, and the umbilical cord and placenta will be put in a normal saline bag and then shipped to a tissue bank. And that's where they process it and carefully separate out the cells and then cryopreserve them. You just lower the temperature by 1 degree per minute, just slowly. So you don't drastically lower the temperature, then you kill the cells, right? It's over. But if you just do it very gently, and they use a little bit of cryopreservative, which the purpose of it is to prevent the crystals from forming to puncture the cell wall. So they don't want water, during temperature changes to harm the cells. That once they're frozen, they're just frozen in animation, really, just slowly. So it's like a person talking slower, slower, right? Just
Yes.
slowing down to the point where, there's just frozen in animation until the doctor's ready to use it. You can thaw it out and the cells will come back to life. If it's processed correctly, by the
Yes.
time you thaw them out, they should be alive. Of course, that there's a technique, in there.
Oh, of course, of course. So, just to be crystal clear for everybody listening, you're saying the mothers are opting to donate their umbilical cord
Oh yeah. So the
with
mothers,
this
right, mothers
consent,
are
etc.
screened. Yeah, are screened. If they don't want to save the cord for themselves, for their own baby, then they can donate. And
Okay.
most of the mothers actually decide to donate.
Interesting. Okay, that's great because I know that's part of the sort of mythology around stem cell therapy is let's just deal with those issues that are out there. I mean, these are ethically manufactured isn't the right word, but ethically collected cells by
Mhm.
consent. So perfect. That's exactly what I wanted to hear. I think that's an
Yeah, and
important thing.
till this day, probably it's less now. I'm hoping I've been dispelling the myths enough, but I used to hear, "Oh, you're killing babies. These are from aborted fetuses and blah blah blah." And no, nobody's
It's
doing
not,
that in
right?
this country. I've
Good.
never met a single. I've never heard of any. It's illegal. Okay, get it out of your mind. In this country, it doesn't happen. If
Yes.
that
Okay.
that happens, report the person.
Yes, yes, yes. And of course, you're referring to the United States for sure. We've got listeners around the world, Dr. Kong. So,
That's true. Yeah, there
yes.
are less, some countries that can provide that. So that's a
Okay.
whole yeah, whole
Okay.
other area.
So,
So
we're talking about your practice, the way you have done the stem cells, is using the correct collection methodologies, ethically consent informed, etc. And so, other places on the planet, less so. So, if you're listening from outside of the United States, make sure you're looking into this subject right here. But for what Dr. Kong and I are discussing today, this is very true. So, tell us, we've got these frozen stem cells and they've been frozen in such a way that they can be reconstituted and used to be helpful. You've talked about autism. Let's talk about some other things. What are stem cells useful for, please?
So first of all, I can't make any claims, and you know that very well, Dr.
Yes,
Fiona.
yes.
Uh, so FDA has only approved a couple conditions, because use for, that's like almost like a trap, right? Laymen don't realize when a doctor says this can be used for, oh boy, you have
Yeah,
just you're about to make a claim, right?
true. This is
So
true.
watch
Yeah.
out. The medical board, the FDA, they're all
Hmm.
watching. Again, we're
Okay.
going to watch these doctors making a claim because FDA approval
Yes.
is condition specific. So you have to go through a drug study to get that approval. However, in medicine, probably 60% of medicine is practiced off label,
Off
right? There's
label.
no
Yep.
approval, but there's a
Hmm.
consensus. However, the way we're using these cells is that
Yes.
we're not using them as drugs. We're using
Okay.
them as a tissue transplant. We're allowing, this is why the legality part, if you want to market and use these drugs, I mean, these stem cells as drugs, then you have to go through the FDA.
Hmm.
However, we're not using them as drugs. We're using them as tissue transplant. So it doesn't need to involve the FDA. It involves the American Association of Tissue Banks. You have to adhere to those standards. The FDA will issue guidelines. I mean, there's a sector of the FDA for the biologics, that they control blood products, vaccines, and then stem cells, etc. So they issue guidelines. However, if you use the tissue the way it's the nature intended these cells to be used for, that whatever that means, and you don't manipulate the cells, then you're just providing tissue transplant. So what can you use them for?
Or how do people use them? How are they used? Let's ask it that way.
The bottom line is that we are supplementing the body, supplementing the ability to heal and repair, the body's ability to heal and repair. So we are assisting the body. So that's the bottom line. The cells are an origin of signals to assist the body. What does it assist? What kind of things is it assisting? So assists in sending signals to your own stem cells to tell your own stem cells to wake up and start make more of yourselves. Live like a stem cell. Come on, be a stem cell, because what you do is that you divide asymmetrically. One is a copy of yourself, so you can keep, doing this. The other one is a differentiated, more specialized cell. So do that, right? So you wake up the cells. A lot of times when the body is in a chronic condition, is stuck, is not getting the message through. The inflammation is so overpowering that the cells are just like kind of stagnating and not really doing what needs to be done. So then the stem cells can come in and speak the right language into these cells, like whispering into your own stem cells and waking them up. Another one is it calms the inflammation. It secretes all these anti-inflammatory, cytokines and different growth factors. It can help calm the body and reduce the inflammation. Inflammation is very much the antithesis of growth, of repair. So you may need inflammation in acute injury, so you can bring about more action into the area. But if you don't move on from that initial acute reaction and you just get stuck there, then the repair is never going to happen. So stem cells can calm the inflammation. It can also shift your immune system, so balances your immune system. If you have too overactive of an immune system, like in autoimmune conditions, these cells can calm it down. And if you have underactive, like in cases of, let's say, infectious diseases or some other kind of, just lack of repair, your immune system is not keeping up with the repair, then the cells can actually boost your immune system. And then it can break down scar tissue, which is really cool. I'm talking specifically about mesenchymal stem cells because they're studied so much and they're everywhere in your body. So they're literally like a resident, like soldiers throughout your body. They're ready to fight for you. And their job is to help you regenerate. So they will break down scar tissue if they have to, and they will grow blood vessels if they have to, and they will tell your cells to make more tissue. And they, of course, calm inflammation. They can salvage damaged tissue, because when things are damaged, like somebody has a crush injury, just the area, or a stroke, the area that got damaged acutely is not actually the final damage. Oftentimes, the area that the blood supply was not cut off ended up dying. Why? Because of signaling cascade from the damaged cells. When the cells die, they spill out all this, signals, the calcium, and all of a sudden, the cells next to it start going down a pathway. So the stem cells can also salvage that, prevent that. And they can also recognize cancer, which is really awesome.
Oh, that's
they have
interesting.
anti-cancer properties. However, just remember, the older you are, the less the capability of your own stem cells to recognize cancer, unfortunately.
Okay. So is this just a matter of, I'm thinking of my next door neighbor hearing this conversation and saying, can I just go and have some fat taken out and then it be processed and I can use that more targeted therapy? From what I'm picking up from how you're talking about it, it would be an IV infusion so of my own stem cells so that my body can take them and use them wherever they need to be used. Is it as
Well,
simple
you
as
can
that?
certainly use your own, and I know plenty of doctors do that. So using fat is a very convenient source, and a lot of people don't like their fat, so they're happy to part
Does
with it.
anybody? Please go on.
So yeah, so it's an easy way to just grab some cells because it's not really about the fat. It's really we're trying to get the blood vessels that's supplying your fat. So it's
Okay.
yeah, because you can't take other tissue, right? Is
Right.
you don't
Right.
want
No,
to
of course not.
you don't want
We
to take
don't
a
have
bunch a
extras.
chunk of muscles. So
No.
right. Yeah, or part of your organ. So you can't really
Yes.
do that. Fat is easily accessible, but we're targeting the blood vessels that's supplying the fat cells, and then you can get the stem cells out of that and use that. So I know a lot of patients and people have gotten good results. I've looked into it. When I first got into the field 9 years ago, I was
Mhm.
like, well, should I do bone marrow stem cells? Should I do fat-derived stem cells? I will do whatever that's the most effective. And that's how I went on a deep dive and realized, oh, when I look at every parameter of the cells, they're not as metabolically active. They're not
Mhm.
as anti-inflammatory. The immune modulating, every property that you look at, they're just not as potent. And also, they have a harder time recognizing cancer. So when you put a stem cell, because from a direct study, looking at a comparison of fat-derived stem cells versus umbilical cord-derived stem cells. You put them next to a cancer cell, in this case, glioblastoma. They put
Mhm.
the cancers, the tumor next to these different stem cells, either
Mhm.
in a petri dish or on an animal's body. So in both cases, the fat-derived stem cells make the tumor grow, whereas the umbilical cord-derived stem cells make the cancer shrink and go away. So they are drastically different. And that's
Different.
why I don't feel like if I'm a doctor, we all evolve in medicine, right?
Mhm.
Oh, here a new and better medicine, a newer option, right? The new
Mhm.
version of things. So if I have something that's better and that's safer, I'm just going to use that one. Like, why would I devote my life to something that may give people less results and cause more problems, right? So that's me as a doctor of how I want to
Mhm.
choose to treat my patients.
Treating
Yeah,
choosing the most potent, the
yeah.
most useful. So you're talking about the mesenchymal stem cells, right? The
Mhm.
MSCs, which is the umbilical cord source. Can those be grown in the lab?
Yes, they can. And actually, they're done all the time. One reason people love MSC so much is because they are easily grown and they seem to retain their characteristics, except that they do change and lose some of the characteristics, even with one passage. So the passage, people talk of P1, P3. So those are passages. So each passage is when you put in cells in an incubator in a container. When it reach confluence, so reach full capacity of the container, that's when you can separate them out, seed them, basically in different containers. And that's a passage. So every time you take them out to start to divide them, that's a passage. So even one passage, they've noticed, oh, there are genetic changes. The cells are morphing. The cells are not the original cells because the cells have a tendency to divide asymmetrically because that's who they are, right? They're stem cells. That's what they do, asymmetrical division. So they rarely do they make perfectly identical copies of themselves. So that's a concern. With your microscope or not as sophisticated equipment, you may be thinking that they're the same, but they're actually not. Genetically, they have moved on. So that's a problem. So when they move on, what happens? They can secrete different cytokines, including some inflammatory ones, because it's stressful. Like they have no business in a petri dish. Like what's going on there? That's a stressful environment. So they will secrete certain inflammatory molecules. And also they start to differentiate, right? Differentiate means gaining function. How do you
Mhm.
gain function? It's through expressing different proteins. Then you can
Mhm.
work, right? You use the proteins to work, receptors and signals. So then you start to grow surface receptors and markers that the cells are expressing the genetic expression of the donor. Now you have a chance for rejection. So if you use very young cells from somebody else, now
Mhm.
you just increase your chance of rejection. So using umbilical cord cells, you divide and divide, and then you put back into somebody's body that's not the donor,
Mhm.
then yeah, you have much higher chance of having side effects. And I've seen that over and over. I'm sure overseas, a lot of clinics do good work and there are good results. However, there's also a higher chance of side effects. And I've heard that quite frequently. Either for some people, it didn't work. For some people, it caused severe fatigue for a few months. Tony
Okay.
Robbins even talk about this cytokine storm that, oh, you're going to get cytokine storm. It's part of the picture, part of the healing process. And then that is just not true.
Not true. Okay.
Yeah. I
Yeah.
have never seen cytokine storm. You shouldn't get them.
No.
Cells are processed properly and the treatment is provided properly. Yeah, you shouldn't have those.
Protein and healthy muscle are the organ of longevity. Do you struggle to put on muscle, lose weight, or get enough protein each day? It's a common concern, but there's help. I prefer Kion Aminos to get my daily essential amino acids. Kion Aminos ensures you're getting the essential amino acids from protein your body needs to rebuild muscle, recovery, keep energetic, and be strong. Kion Aminos is a clean source, transparent formula that gets mixed into water and tastes good. It's suitable for all diets, is gluten free and dairy free. It helps me feel full and hydrated and ready to go. I feel strong and I recover from activity quicker when my protein tank is full. Would you like to get better protein intake and supplement with Kion Aminos? Please go to getkion.com/lovely, where Kion is offering 20% off for listeners of the show. There's a risk-free 60-day money-back guarantee. That's getkion.com/lovely. And I'll drop the link in the show notes. Thanks, Kion. Hey guys, Dr. Lovely here again. Sorry to butt in while you're listening to this episode. But in case you don't know, I send out an awesome newsletter every 2 weeks. It's called Fiona's Friday Favorites, and I'm getting lots of great feedback about it. I pack it full of the latest and greatest in menopause and perimenopause information, whether it's research or treatment options or my favorite supplement or my favorite yoga pose or recipe or book or podcast of that 2 week period. People are loving it. So go to drlovely.com. That's drlovely.com. And right at the top where it says shift here, enter your name and your email address, and we'll be sure to add you to the list of Fiona's Friday favorites. Thanks for listening.
The times I've seen a couple of patients getting fevers and chills, and these are people who actually have some kind of underlying infection. So it's like your body is triggered into this
Yes.
fighting mode. Um,
Yes.
yeah, but that's very, very rare.
Okay, okay. And like when someone is having stem cell treatment, let's say they're having an IV infusion, what sort of things do they normally expect to feel? I know normal is such a funny word. What do you see? Do they feel more energy? Do they sleep better? What is it like having the experience?
Depending on if they were having problems, right? If there's no problem, then the common thing is feeling more energy. Yeah, the energy is a main thing that people talk about. And people may feel, have a higher sex drive, their focus is better.
That sounds pretty good,
Yeah,
all of that, to be honest.
aches and pains. Yeah, so
Okay.
go away. So that's the comment, or just, feeling rejuvenated, like a sense of well-being. So
Okay.
that's but a lot of people also say they don't notice any difference.
Mm,
I actually am one of them. So when I take it, because I've been taking it on regular, actually today I'm going to get another infusion. I do it every 3 months. That is my anti-aging, like the
yeah,
cornerstone of my anti-aging regimen. So regular IV stem cells, and I've done, in 9 years, that's a lot of stem cell infusions.
sure.
And most of the time I don't notice anything, but it doesn't mean that it's not doing something for me. I don't have anything wrong per se. Um, but what
You want to
I
keep it that
know,
way.
but I'm also aging, right?
Yes,
Like
yes,
all of us, right? I don't
yes,
think there's
yes.
anyone living on this earth that's not aging. So the cells actually has incredible anti-aging benefits. And this has been demonstrated through animal studies. When they looked at mice and rats who only live for about 20 months, when they give them regular IV stem cells, they actually end up extending their lifespan by about 30%. That's been pretty consistent. And not just extending lifespan, but also health span.
Hmm.
The mice and rats look a lot younger and they
Hmm.
move better.
Wow.
Their cognition is better. Yeah, as if they were younger. And then when they
Yes.
dissected their muscles and brain and look at the neurotransmitters and the growth factors and the cellular waste product accumulation, all the markers of where the cells is at as far as
Hmm.
its health and age,
Hmm.
everything was dialed back. Everything was brought back to the earlier stage.
Wow, that's so interesting. Oh, I have so many questions I want to ask you, but let me ask this because this show is ultimately for women in midlife, perimenopause and menopause. Would you say that there is application for stem cell therapy for women in their menopause era?
Yeah, absolutely. I mean, it's just part of the aging process. I don't think menopause is anything mysterious. It's just a part of the aging of your reproductive system, your hormonal system. So if you have everything, dialed in, you shouldn't suffer from those symptoms. So um, we know stem cells can enhance fertility in some of the studies. Not as many human studies, but definitely animal studies. Like one of them was very powerful. They were looking at perimenopausal rats. So there
Okay.
is a thing, perimenopausal rats, and they started giving them stem cells. And
Okay.
then they looked at their ovary, the size of the ovary, how many follicles it contains, and all the estrogen, progesterone production, and then the number of pregnancies. Everything was
Okay.
improved, right? A lot more pregnancies and better hormones. So everything was brought back to a younger state. So that's what it can
Oof,
do
that's
for your reproductive
interesting.
system. Yeah.
So I know I feel it we're both dancing the line right of asking specific things about specific claims, let's say health claims, but I know there is a body of evidence on the ovarian senescence in particular, or the for those listening, the natural aging process of ovarian tissue and how that process turns on now the aging of bones, brain, heart, etc. And so, could it be that slowing the natural aging? I'm choosing my words very carefully, Dr. Kong. You tell me if I need to change what I'm saying. Changing the ovarian senescence could then keep all of those other systems healthier longer. Is that ultimately what we're talking about here?
I believe so. Yeah. I
Awesome.
think I think that's why well, when you look at the animals that they, everything. I don't know if they, in that case, the longevity study, they studied the fertility, but it's the health of all your tissue. I mean, this is a
Yes.
global effect. Yeah. So
Fascinating. Fascinating.
yeah,
You
this is
know,
why I can't think of anything that's more holistic than stem cell therapy. It literally is the origin of messages of your body, all the
yes.
messages.
It sure is.
All together. Yes.
Well, this is amazing because when I thought we were going to have this conversation, when I was thinking about this conversation, doing my research for leading up to this chat, I thought we were going to be talking about can I do stem cells and have instead of having a hip replacement, right? But actually, what I'm realizing in talking to you is that it's not even that specific. We go way back and we just go, no, we're just going to make everything work better, right? But I want to say that I think the first time I heard stem cells in the context of therapy, I was probably in my first 2 years or so of practice, and Peyton Manning was the quarterback for the Indiana Colts at the time, and he was having he might have been with the Broncos at the time. Anyways, forgive me, someone will tell me that I got that little statistic wrong, but he went off to Germany and had stem cells on his neck because he was having neck problems. And
Mm.
I remember thinking at the time, I was like, oh, I wonder how that works. Like, is that just an injection in the joint itself? Of course, but again, I'm a joint doctor, so that's what I'm interested. That's what I'm looking at and thinking about it. But it's far more global than that.
Oh, yeah.
Okay, well,
Well,
thank you for
my
educating
very
me.
first patient, I'll just give you an example of my very
Please.
first patient who was a 69-year-old gentleman with osteoarthritis in both knees. And so he was concerned about his knees because two separate orthopedic surgeons told him, absolutely, you need bilateral knee replacement. You're in bad shape. So that's what he was looking at. He didn't want that to happen. And then I was like, well, I have stem cells. How about let's try that? He said, yes, let's do it. So I give him an IV infusion of stem cells because really, when you look at osteoarthritis, why don't little kids have osteoarthritis? If you think the condition is a wear and tear disease, it's not a wear and tear disease. It's an inflammatory disease. Your body can't keep up anymore. This is your whole body is falling behind. So it has nothing to do with wear and tear. Maybe when you were wearing and tearing, it's making it more difficult. Now you just created more injury. Now you can't heal. The problem is that you can't heal, not the injury itself. So we have to address the full body. I give him an IV, and also because the larger joints like the knees and hips and shoulder, the outer 1/3 of the cartilage is nourished by the blood supply. The inner 2/3 are nourished by the synovial fluid. So you want to attack from both angles, as far if you want to trigger those cartilage to regenerate. So I give him IV and put some in his knees. And what's funny was the next day he said, well, I slept through the night and I haven't slept through the night for decades because every time when I rolled over, my rotator cuff injury that sustained when I was very young actually wakes me up. But I didn't wake up last night. And he never was bothered by that again. So what happened? Like you mentioned, the cells will do what they do. They go in there,
Yep. They
it's a
repair.
global effect. Yes, they
Yes.
find places. The shoulder probably has been screaming, for help, but your body just couldn't give the help. And cells recognize those signals. They that's their job to detect inflammation and injury, and they will aggregate in that area and start to produce give you the right signals, right? Tell you what to do. And now your cells can hear clearly. Before it was just like in a fog. Now it's all lifted. Now the cells can go to work. Now the tissue is getting repaired. The inflammation's down, and then you can repair. So that's the beauty of of stem
Okay.
cell therapy. Of course, I was
Yes.
hooked. And
Yeah. I
how
would
would
be
you feel?
too.
Yeah, I was a psychiatrist. How do you
Yeah.
think I felt? Right?
Oh, I
I was
thought
like,
you probably felt duped. You were like, wait a minute. Why didn't anybody mention this to me before now?
yeah,
Right?
I was like your orthopedic surgeon needs to talk to me, like I can
Yes.
teach them something.
Wow. I can only imagine. Well, I feel just a modicum of the excitement that you must have felt at that time, just listening to you speak
Yeah.
about it, but also the
Yeah, and of course now is
possibility.
9 years later. The guy's still walking around, still go to more trade shows than anybody I know. He's
That's,
walking around, walking 4 miles a day. It's beautiful. You don't have to subject yourself to that. If you wake up your body,
yes.
then you will be you may be very, very happily surprised.
So, how do we find out for our international listeners? How do we find out if stem cells are being done in our country? Is there like an international governing body? How do we look into that if we don't happen to be nearby you?
Yeah, it's a little bit of Wild West. And a lot of countries are not very open. I know Canada is not open, Australia is not open, UK is not open. So we have people flying from all around the world to
I see.
come to the US. Yeah, so the places that are a little bit more open will be Central and South America.
Okay.
They seem to have, they don't really they don't feel that there's they need to restrict this area so much. But my issue with them is that they do expand the cells, which I don't think is necessary
Mhm.
because we're getting tremendous results without changing these cells. When you change them, there's more side effects and there's more chance of rejection, and possibly they're less potent, because that's what some research have shown, is that you can give 10 times the number of cells and end up having less results because the
Mm.
cells have changed and they're just not working as well.
Okay, no, that's good to know. Now, when you say not open, meaning not open to the harvesting of the tissue of the
Yeah, just
umbilical
not
cord.
open to the whole field,
I
that
see.
so
I see.
new and they're so stuck in the conventional medical model.
Let's hope that's all changing as we have arrived into the age of Aquarius, but that's a conversation for another day. Let me ask this question because I am a personal fan of Dr. Peter Attia's work. And so when I talk about the four horsemen, the things that that it typically age us, cardiovascular disease, cancer, metabolic disease, and neurodegeneration. That's the question I have that's sort of left in my mind now, and I'm going to try to ask it in a way that will leave the your answer sort of open to whatever you need it to be. Is there an application for stem cells in neurodegenerative diseases like Parkinson's, Alzheimer's, dementia, etc.? Which maybe I'll just pull back from that. Like, is there an application here? Is it being
There
studied?
has been research. Yes, there has been.
Okay.
I wish there's more, but there has been some research. Neurodegenerative conditions are definitely some of the tougher conditions, but even in our clinic, we've seen just some really wonderful results, getting people out of wheelchair and, getting them to walk. And yeah, it's been pretty amazing. And dementia really not only slowing it down, but reversing, right? Gaining better
Wow.
function, better brain
Wow.
function. So we've definitely seen that traumatic brain injury is tremendous when it comes to repairing the brain. MS, I've had really good success with that. Yeah, so even ALS, I remember a patient
Wow.
who, started to be able to actually eat regular food, like eating beef from,
That's huge.
not being able to swallow and pretty
Yeah.
much relying on liquids. Yeah, so definitely we've seen
Some
just
interesting things.
wonderful things that no other routes are able to to
Yes.
bring. Yeah.
Right. Okay. I got what you're saying. So stem cells then can cross the blood-brain barrier.
The mesenchymal stem cells can't, to some extent.
Okay.
It's um, not a thoroughfare, but some can get through. But in our clinic, we do use mannitol to infuse patients prior to the stem cells because they actually shrink the gap junctions of the blood-brain barrier. It's commonly used in emergency rooms when
Mhm.
somebody has had a brain injury, to allow the fluid to come out of the brain, and instead of the brain in the brain, but actually leave the brain region, open up the blood-brain barrier. But
Mhm.
we use the fact that they are more open, so more cells can actually pass through. The mannitol also has its own antioxidant and neuroprotective effect, so it's nice to combine the two. And then we can use exosomes, which will cross the blood-brain barrier with no issues because they're nanoparticles secreted by the stem cells. So if you let the stem cells circulate, they will produce all these exosomes, and the exosomes will get to the brain. However, we in our clinic, we also do intranasal route, allowing more to be uptaken directly into the brain, because your mucous membrane and then your nerves will actually take these particles into the brain.
Wow. Well, we're this is Jetson style science today. I love it. I'm just totally here for all the wonderful ways we are learning how to do it better. That's the way
Hmm.
I look at it. And
Yeah.
I have just learned a whole lot from you today, Dr. Kong. Thank you for bringing your information to the show. I think this will be really useful. There'll be somebody that will be listening that will, they've been waiting for what you just talked about, and hopefully
Mm.
many people. So where can people find out more about you and your stem cell therapy?
Yeah, so I'm doing several things. I have a clinic in Los Angeles. I also have an academy where I train a lot of physicians. I'm the founder of a stem cell company that provide products, and I've developed formulations that are really unique and with high potency. So I'm all about integrity. So scientific integrity or just integrity as a business. How do you bring integrity to what you do and to give people the best type of cells. Um, and to me, that's really important. And unfortunately, in this space, in the stem cell space, there's a lot of lack of integrity, and that's why I decided to do it on my own. But so in my website, joycongmd.com, it talks about everything that I do. I've uh, also developed a skin cream called Chara Omni, and that's a stem cell cream. It's 100% natural. It's got stem cells and peptides and a lot of herbal extracts and antioxidants, prebiotics. So it's a pretty amazing cream. And then I wrote a memoir, Tiger of Aging. So everything is there. So if people want to look at that. And then my YouTube channel is a really good resource. If anyone wants to know a lot more about stem cell therapy, please go to my YouTube channel. It's Joy Kong MD. Just yesterday, I published one talking about side effects of stem cell therapy. So there's still, it's a conversation. And there's so many things to go over if we're talking about side effects, because the cells are going to be different. Like, what kind of cells are you talking about? And how's the doctor using it? How's the doctor giving it to you? I mean, all these are factors. So you can't just say, oh yeah, you side effects. It's not simple, right? But I break a lot of different topics down. So that's a really good resource. And people can find me on Instagram too, I guess. Just at Dr._Joy_Kong. And people can contact me if they want to.
Okay, I love it. By the way, are you using your own cream? Because your skin is gorgeous.
Oh, I am. Yeah, I'm
Okay.
definitely I would say my two tricks is IV stem cell infusion and my own cream. That's it.
Okay, I'm
Yeah.
looking at you and you're going to tell me that your age is like 117 and I'm looking at you going, you look 27
Oh, thank you so much. Well, I'll tell you my age. I'm almost 54. I'm 53 years old. Yeah,
and
but
fabulous.
thank you. Yeah, so I mean, that's why, when you said anti-aging, this is a real possibility that we're here.
Mhm.
And I say yes. It is a little scary because it's uncharted territory. All of a
It's new.
sudden, we can live as if we are, younger and for a very, very long time. So we're literally, it's a time we're creating two kinds of humans. One kind is the one that's a regular one, the regular aging, right? If you're 50, you look 50, you're 60, you look 60, and that's it. And then there's going to be a whole other group. They're going to be 50, 60, 70, and they still look like they're 40. Like, what's up with this group?
I want to be in that group. We
So
are
that's
already
a real
there.
reality. Yeah.
Wonderful. Well, thank you so much for dispensing this information on the show. I think it is just so unique and interesting to hear where medicine, where science is around this regenerative practice. So thank you, Dr. Joy Kong,
Yeah, it is
for
here
coming
to
on the show.
stay, let me tell you. It's
I
not
love it.
going anywhere, even though the government is not really, they say they're supportive, they're not really. So
They could be
making the
better supportive.
industry,
Yep.
yeah, people jump through a lot of hoops and trying to catch people. If they can't talk about science, they can't talk about research. For example, I was made to take down any mention of research studies in our company's website because that is equivalent in their eyes to making claims.
That's
So,
what happens when a bureaucrat makes decisions and not a medical
yeah.
professional.
So when is it not okay for me to to
Yeah.
share scientific information.
Yeah.
Why is that just why is that not good? Like,
Mhm.
so don't people
Which,
deserve to know? So
yes.
anyhow, so despite that,
Yes.
stem cells are just getting hotter and hotter and hotter. It's like a wildfire they can't
Mhm.
contain, period. Because people want to feel better.
Mhm.
People are sick and tired of being sick, right? That they
Yes.
who wants to be in live this life and be sick, and you tell them that there's no way to get better, but they found out about stem cells. Their friends got better, so they're gonna
Mhm.
try it. You can't
Mhm.
stop that.
Mm-mm. No, no, you can't. They're going to try because they always do. And humans will find a way because we always do. And innovation is a beautiful thing.
Yes.
And human ingenuity, when those two things go together, it's fireworks. And as I
Yes.
said, I'm
And
here for it.
courage. Have some
Oh,
courage. I want
yes.
doctors. I want doctors to grow grow some a pair
Yeah.
and have some courage.
Like
Do
stem
what's
cells to grow
right.
up hair.
Yeah. Right. That's right. You girls can have very big pairs.
Well, and we just I love it. We just threw around a bunch of words. Let's throw in curiosity and integrity in there too. And if we all operated from those places, the world would just be a better place, just
Yeah,
overall.
that's
Dr.
right.
Kong, I have a question I ask everyone at the end of the show that I'd like to ask you now, please, if I may. And please have some fun with it. Don't be too serious about it. It's all good.
Okay.
Knowing what you know now in your life, what would you tell your younger self?
Yeah, I don't know. I've always been pretty courageous and pretty yeah, very driven, but probably just not take myself so seriously. Yeah, because it really is kind of a game. This life is a gift. You're here to play. You're here to play this game and have fun and to enjoy. Uh, that's the thing I think what every one of us, should remember. But yeah, I
Don't be
think
so serious, right?
that's right. Yeah,
Yeah,
keep it light
I
and
like that.
laugh. Yes.
You are the tiger of Beijing. I like this.
Oh yeah, if anyone's interested in listening to my story, it's on Amazon, Tiger Beijing, and it's also on Audible. So it's a good story. Yeah, I'm
I
just gonna
like that.
tell people caveat.
Please.
If you want to know how I got into regenerative medicine, you're not gonna find that in the book. The book is a good story. It's about how I came to America and how I survived the first 2 years. None of the two was easy. So,
Mm. Mm. It's the trials and tribulations that make us in the end.
yeah.
Dr. Joy Kong, thank you for coming on the Not Your Mother's Menopause podcast.
Yeah, it's been such a pleasure.
Thank you. The information and other content provided in this show, or in any linked materials, is not intended and should not be construed as medical advice, nor is the information a substitute for professional medical expertise or treatment. We are doctors, but we aren't your doctor. Seek your doctor's opinion. If you or any other person has a medical concern, you should consult with your healthcare provider or seek other professional medical treatment. Never disregard professional medical advice or delay in seeking it because of something that you have heard in this podcast or in any linked materials. If you think you may have a medical emergency, call your doctor or emergency services immediately. The opinions and views expressed on this page and in this show have no relation to those of any academic, hospital, health practice, or other institution. Thank you.